from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is Healthcast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to Healthcast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about resources for new parents on the Suncoast. Our guest today is Dr. Chelsea Arnold, a nurse practitioner and the initiative manager for First 1000 Days Suncoast. Chelsea, thank you so much for being with us.
Thank you for having me.
So what exactly is First 1000 Days?
First 1000 Days is a regional initiative comprised of over 90 partner organizations, all working to improve coordination of services and increase access to care for pregnant individuals and families with young children. It was spearheaded by the Charles and Marjorie Barancik Foundation a little over 4 years ago. And Sarasota Memorial Healthcare System is the backbone organization, which means that we lead all operations for the initiative.
What are some of the projects this initiative has launched in the community?
Yeah, so one of the things that we pride ourselves on is listening to parents in the community and also professionals, looking at regional data and also lived experience data to come up with innovative programs to address any barriers that we find families are facing. One of the biggest projects that we've implemented is a navigation program. We have a family navigator that responds to any incoming assistance requests on our website, and that family navigator helps families or parents connect with resources through our partner agencies. This is really a place where families can go if they are not connected with any services or they're overwhelmed and not sure what they would qualify for. Our family navigator is there to make sure that they get everything that they need, really addressing those social determinant of health needs, such as housing, food, childcare, jobs, etc. And then another program that we helped facilitate was the Plan of Safe Care. And the Plan of Safe Care is for substance-exposed newborns and their families, and it makes sure that there's a plan in place when that baby is born so that they are safe and healthy and supported. And then last is the Perinatal Mental Health Coordination Hub. This is something we recently launched in January with partnerships with Healthy Start coalitions, also a lot of the big mental health agencies. And it's really to make sure that any pregnant or postpartum individuals can get connected with mental health resources.
I want to talk a little bit more about that Perinatal Mental Health Coordination Hub project. What else can you tell us? Because that's pretty new.
Yes, what we found from numerous parent focus groups that we did across the community, from professionals that we work with, and then also just the individuals that we were working with through our navigation program, was that mental health navigation was a big barrier for a lot of individuals, and also knowing what are those signs and symptoms of depression, anxiety, and other mood disorders. So the Perinatal Mental Health Coordination Hub has 3 big components. The first one is really encouraging routine screening in OB and pediatric settings and making sure that those providers have the tools they need to refer families to the services that they need. The second piece is really reducing the stigma of reaching out for help and making sure that families or individuals that are struggling know the resources that are available to them and what signs to look for. And then the third piece is really that coordination hub. So anyone that is out in the community that needs help navigating those services, knowing what they're eligible for, talking a little bit more of maybe what are those signs and symptoms and do you think that I'm struggling, our navigator then connects them with those big mental health agencies that can support them.
Why is it so important to have a resource like this available locally?
Yeah, the first 1,000 days of a child's life are the most critical. And this is really because 80% of brain development happens before a child is age 2. So we know that connecting these families with the resources they need to ensure their children thrive is really important. You can think about it as the earlier the investment, the greater the return. The more support we give children earlier in life, the more successful, happy, resilient, and healthy they're going to be.
So who is reaching out to First 1000 Days? Can you give us some examples of people who might be coming to you guys?
Yeah, a wide array of different individuals are coming to us. We've had teenagers that were pregnant come through First 1000 Days and get connected with resources. We've had grandparents, foster parents, mothers, fathers, really anyone that touches the lives of a child, we're able to connect them with the services they need.
How do you incorporate parents with lived experience in the work of First 1000 Days? And we'll talk a little bit about Unite Us later.
Sure. Lived experience is one of the most important, if not the most important component of First 1000 Days. We know to create something that's sustainable, effective, and impactful, we need to hear directly from the individuals that we're working hard to serve. So we have done parent focus groups across the region, working with over 140 different parents. We also have a parent advisory committee, and that ensures that parents are involved at the highest leadership structure of the initiative, really guiding the strategy, any of the projects that we're working on.
And why is that so important? How does that impact the services you guys are able to provide?
Of course, working directly with these parents, they have provided us with a lot of insight that we otherwise would have not known about. And they've helped us come up with unique marketing ideas using social media. They look at all of our materials, all of our ad campaigns, all of our flyers to make sure that it really is something that resonates with them and will also resonate with others that are maybe struggling in a similar situation.
If a new parent or one of those groups that you've talked about, whether it be grandparents, foster parents, et cetera, watching this or listening to this and say, I want to learn more, maybe I need some of those resources or some of that help, how can they learn more?
Of course, they can go to our website. It's www.first1000dayssuncoast, or they can give us a call at 941-917-7421. And our family navigator, Tina Wilson, would be happy to speak with them.
So before I mentioned the Unite Us program, I want to talk about that a little bit. What is it and why was it launched on the Suncoast?
Yeah, so difficulty navigating the system was one of the top barriers to care identified by professionals and parents. And really, to address this big barrier that was identified, we knew that we needed to bring a platform to our community that could connect all the different service providers onto one system. Unite Us is an electronic referral platform that connects medical, mental health, and social services all under one network. What this means is that there's a no wrong door approach to care. So no matter who's working with a family or a parent, they can connect them with any services that they can't provide in-house for them. For Sarasota Memorial Healthcare System, we were able to implement this in the Women and Children Services first. Since launching in 2020, we have sent over 5,000 referrals and helped over 2,700 patients get connected with all of our various nonprofit partners. It has a closed loop system, which means when we send referrals out to our community partners, we know whether individuals were able to get connected with the care that they were referred for. And in addition to that, we have real-time data dashboards where we can look at any race or place-based inequities, any barriers, capacity concerns, and then work with our nonprofit partners to come up with innovative solutions to really address them. And that's what a lot of our projects came from and stemmed from, was looking at that community data, identifying trends, bringing it to parents, and then coming up with some programs to address it.
So can you give us some examples or how this is currently working, how it's currently used?
Yeah, it's at Sarasota Memorial Healthcare System. It's used in a few different ways. The first is in the OB Emergency Care Center, the OBECC. All pregnant women are screened for social determinant of health needs. So housing, food, childcare, mental health. And then if they need something, we refer them using Unite Us to all the community partner agencies. Another way we're using this is First 1,000 Days through our navigation program. Our family navigator uses Unite Us to send those referrals to community partner agencies. And then the third thing is the case managers in the Women and Children's Division are using Unite Us for any community referrals when they see patients on the floor.
And now Unite Us is going to be implemented system-wide at Sarasota Memorial Healthcare System. Tell us what that means and what impacts it'll have on the health of all patients locally.
It's really exciting news to be able to implement something like this system-wide at Sarasota Memorial Healthcare System. We were able to pilot it in Women and Children's Services. We saw the impact that it had. And it really just shows that Sarasota Memorial is dedicated to helping all patients, not just inside the hospital walls, but also to the community at large, and making sure that people can get connected to the resources they need. We know that social determinants of health can impact a person's health up to 80%. And so we need to make sure that we're addressing those social determinants to prevent them from coming into the emergency department, to prevent all these chronic health conditions that people are developing. And I, for one, am just so proud to work for a healthcare system that is doing something so forward-thinking and innovative to make sure that we're helping everyone.
What's your hope as this rolls out to the entire healthcare system?
I think my hope is that we're able to build something like First 1,000 Days system-wide, that really the navigators that are already embedded in the healthcare system and doing fantastic work at Sarasota Memorial can then have an additional tool to be able to have peace of mind that they know the individuals that they're serving get connected to the care that they need. Also to determine what services are missing out in the community and work together to come up with innovative solutions for different populations, for the geriatric population, for behavioral health. Any of those different divisions can work together with our nonprofit partners to really be able to focus on the health of our community.
First 1,000 Days is such an exciting initiative. What do you want the community to know?
First 1,000 Days has numerous different components that make it unique, but also incredibly impactful. We are working directly with parents to make sure that they get the supports that they need, also empowering them to be leaders themselves. I want people to know that our partner agencies are a critical piece of this work, and without them, none of the projects that we have created would have been possible. Also, this was completely funded through philanthropy. So I just want to give a big shout out to the local foundations and individual donors that are supporting our efforts, because without them, our work would not have been possible. And also to Sarasota Memorial for giving me just an incredible job, giving me a wonderful team, and a place to be able to do such impactful work.
What does it mean to you to see the impact this has had already on parents?
Yeah, I worked at the Sarasota County Health Department as a nurse practitioner before I came into this role, and I saw firsthand the struggles that families faced in getting connected with services to address social determinant of health needs. And it was really a struggle for me. I hated that they didn't have the support that they needed. And being in this role, I'm really able to do some systems level work and improve the supports that families have directly. So it's been a really, really wonderful thing to see the transformation just over the last several years.
Chelsea Arnold, thank you so much for being with us today. And as always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.